All right. Well, good afternoon. I feel like we're seeing each other a little more often than usual, obviously. Hope you're all keeping well. I've been reaching out to some officials in our community. As you may have seen earlier this week, we talked with Chief Norm Hansen of the Sarnia Police Services, and there's some others interviews coming up because I see so much out there on social media, that social media thing, and I'm receiving all kinds of videos and audios. My inbox lights up more than usual. I'm sure yours is as well. But one thing I've learned is to get it from the horse's mouth, so to speak. Official government websites, official medical websites, etc. So I reached out to the Bluewater Health, and we were able to get in touch with Dr. Haddad, who is the Chief of Staff for Bluewater Health. And we weren't able to do this live just because of schedules not being able to connect together. But we did. I just finished an interview about a half an hour ago, almost an hour ago, I guess now, with the Chief of Staff of Bluewater Health. So I'm going to take you to that interview right now. If you do have some comments, feel free to share them, and we'll take a look at those, and we'll have some phone numbers, etc., for you to get your questions answered as well. But right now, I want to take you to this interview again with Dr. Haddad, who is the Chief of Staff for Bluewater Health, and then I'll be back. All right. Well, joining us here this afternoon is the Chief of Staff for Bluewater Health, Dr. Haddad. Thank you so much for joining me today.
Thank you for having me.
Certainly busy times with you right now. We'll just kind of get to the point. I know you've got lots of things to catch up with. Can you give us sort of the official number that you're able to share with us right now of the cases confirmed?
So over the past week or so, we've since we started testing, we had been waiting for results to come in. So for a few days, we had 0 cases because we were just waiting for the results to come back. But as of 2 days ago, we had confirmation that 5 of our patients at the hospital are confirmed positive for COVID-19. And yesterday, we had 2 more confirmed positive. So these patients have been slowly trickling in over the past few days, but the results finally came back. So as of now, we have 7 confirmed positives. We still have a few more pending results. So I don't know what the number is going to be by this weekend or next week.
Okay. So I guess next questions, what's the hospital doing to prepare for what I guess would be expected to come? And is Sarnia-Lambton ready for all of this?
We are. We've been doing a lot of work actually in preparation. So stage 1 of the whole pandemic planning. Since, 2 weeks ago when the WHO declared that COVID-19 is a pandemic, so basically across all continents, we flexed into our pandemic planning pathways right away. And we had been obviously monitoring the virus in Europe, starting in China and then in Italy and Spain. It obviously has arrived to North America. So 2 weeks ago, we activated our pandemic planning, which includes a lot of different pathways. So it looks at supplies, supply chain, staffing, creating capacity in anticipation of a wave of patients, even though we had no patients at the time, but you have to be prepared. We engage with our providers, for example, the surgeons, to cancel elective cases, to reduce the pressure on the hospital in terms of using supplies and also creating more bed capacity. We worked very closely with primary care in the community as well to see if they can help us out to reduce the pressure on our ED, for example, by looking after patients in their offices. Also, we worked with them to convert their practices to more virtual care, so if they can look after things with using a phone call or FaceTime or something, in order to reduce traffic within their offices, to reduce the spread of the virus, given the social distancing that we've been exercising both at the hospital and the community. So with all this happening, we also work very hard with long-term care facilities to ensure that, and home care as well, to ensure that patients can safely go home, or long-term care homes, and leave the hospital with wraparound services, so they're discharged in a safe fashion. With all these steps, we were able to reduce our hospital occupancy from more than 90% down to 65%, which freed up almost 100 beds within the hospital. And specifically, we really worked hard on ensuring that we have enough ICU capacity, because some of the patients would need life-sustaining measures like ventilators, for example. So Part of the pandemic planning is ensuring we have enough ICU beds, looking at ER protocols, EMS, how the patients come in and treated, updating and ensuring that our treatment protocols are up to speed, looking at the best evidence and experience from the treating teams in China and Europe about how best to treat this virus once it affects a patient. A lot of work on the supply chains and the so-called personal protective equipment, PPEs. I'm sure the audience have heard a lot from the news about the lack of supplies, given that a lot of the masks and gowns and gloves are actually manufactured in China. They had a bit of a big hit when they closed down their factories, so it affected the whole world. And I'm hearing that the factories in China are ramping up services now as they seem to be in a better shape from a pandemic standpoint. But that will take 2-3 days. It will take 2-3 days for the supplies to reach. Having said this, we do have reserves in stocks for pandemic planning. But I have to admit, I've been very impressed by the response of the community and the multiple emails and phone calls we're receiving to offer donations to get masks and gowns and gloves and whatever we need. It's really impressive. And at the same time, I'm not surprised, given that Sarnia-Lambton, generally speaking, the population here, as you know, is very generous to help, in helping their hospital. So,
for sure. And I know that a lot of people have offered to make masks and donate them, but correct me if I'm wrong, but unfortunately, they're not regulated. They have to be regulated masks. So while people have good intentions, there's other ways that they need to find to donate, right?
I really admire and love the efforts and the thoughts that went into it. The issue with the homemade equipment is that it doesn't pass the industrial guidelines of the government, and we can't guarantee that actually it's going to catch the virus or protect our staff. So we have to go by what's officially manufactured by.
And I understand, I believe Lambton College has also stepped in and helped out. I think they donated 30 beds right now.
A whole bunch of beds. I was very happy yesterday when I saw that. Yeah, it's being shipped over. Awesome. Thanks. Yeah.
So moving forward and all this, I mean, if we haven't heard the words "stay home" by now, then you're not paying attention, right? But what are you asking the community to do?
I've been saying this for a while. The first line of defense to reduce the burden of this disease is actually the community. It's an infectious pathogen, so the host is humans. So it basically goes in between human to human. So the best way to reduce the spread is for all of us to separate, basically, by at least 6 feet. And that's why the whole social distancing thing or physical distancing came about. So if our population can stay at home for whatever it takes, I'm hoping not, obviously not forever, but 2, 3, 4 weeks, whatever is decided by public health, to at least give us a chance to reduce that spread so the healthcare system can absorb the volume, that would be quite beneficial. Obviously, the virus has arrived in North America, but if everybody gets sick at the same time, then the system won't be able to absorb the volume. This is what happened in Italy, as you've seen on TV. But if you can, what we call flatten the curve, so basically bring the illness in a slower aliquot by basically all of us separating, so you have less patients, then our resources can flex up a bit more and accommodate, but still be able to treat everybody. It might take us a bit longer to do so, but nevertheless, we can still able to accommodate. So the community is the first line of defense. So please stay at home unless it's essential to go out. And my advice is designate one person to go out, do the essential shopping, maybe once a week, not every day.
Right.
At the same time, I have to admit also, I mean, these are my neighbors and our neighbors and friends and families, and it's been very difficult. So just like us being here at the front line of fighting the actual illness at the hospital, all of you are the front line, because someone who's taking a big hit and sitting at home and not working is a huge sacrifice as well. So we're all in it together, and I appreciate all of us are appreciating what's been done. The second thing that the community can help us with is also try to deal with more minor ailments at home or with their primary care provider, as opposed to coming into the ED to just take the pressure off the hospital a bit. So if someone has the sniffles or a minor cold or something, maybe try to isolate, stay at home as much as you can. Sure. Unless you're obviously sick enough to come to the hospital, that's different, and we'll have to treat you here as well. When someone comes in very sick to the hospital, we are basically the last line of defense, and we flex up, and we'll have to do what we can to save a life.
Okay. Now saying that, stay home. Okay. Well, I'll give an example. I'm home. There's just myself and my wife, and I've heard this communication. It's just the two of us. I have two children, but I told them to stay at their mother's. That's where they were last, so we're dealing with that. But are we supposed to stay away from each other in the home, or like we don't think we have it, or stay over there on your side of the bed? What are the limitations there?
So it's not very practical. Having said this, if someone in the household is exhibiting signs of illness, so let's say you have a cold or a fever, then yes, you should separate, use a different bathroom, different bedroom, just like any other time. If you have influenza or a flu,
Right.
you don't want to be mingling with your rest of the family. But if everybody seems to be healthy at home, then just go on with your life, and just common sense. Don't use the same towels, all that stuff.
Right.
You have to be practical. It's hard to live. I mean, we're social animals in a way. I mean, we can't live alone. It's hard to be single, especially if you're in the same household. But still, even dividing and not be too close, even with your neighbor, would be quite beneficial. Because if there's a break in a household that's still contained, you can fix that with 3-4 people,
Right.
as a whole neighborhood. So having a neighborhood party is a big problem.
Right. Okay, so my wife will be happy to know that then. How are the staff holding up in all of this? I mean, you talk about the front line, and there's a lot of people putting things on the line more than normal. How's everybody doing?
The staff here is actually quite remarkable. We've been talking about this for many days and preparing for it. We've gone over a lot of the preparedness in terms of refreshing our minds about how to use all the gowns and gloves and personal equipment, and how to take masks off and on, and going over different protocols and treatment plans. So it's been quite a time. Of course, there's always the usual anxieties and fears and anticipation of something that could get you. But everyone is so remarkable, and I'm feeling this fighting spirit, especially in our frontline departments, in the ER and ICU, that everybody's like, well, bring it on, we'll take care of it. And I think our city and county should be quite proud of our frontline here.
Yeah, well, I know the community is very grateful for the front line and everybody involved. There's a lot of things happening behind the scenes, folks, as well. Nobody's here to get any credit, but I know a lot of people are very grateful for all of this.
The whole team, there's a lot of, it's sort of like a movie theater. You might see the actors, but you're not going to see the people behind the scene who are actually making the show. So at all layers in the hospital, from housekeeping, cleaning, administration, supply chain, nurses, doctors, respiratory therapists, the food staff, the kitchen staff, everybody is flexing, working as one team to make this happen. It takes a village, So
yeah,
I want
for
to get
sure,
to all of them.
For sure. I know you've got some other meetings to get to, so just time for one more question. What are the next days ahead going to hold? Is this the calm before the storm, so to speak?
It could be the calm before a storm, or maybe if we're lucky, we won't get the storm. We'll see. If we don't get the storm, then great, we'll have a big party at the end of it. If it is the calm before the storm, then we're ready for the storm. So we'll see. I think the next few days will tell us how it's going to go. Maybe we'll have another meeting and update then.
Very good. We would enjoy that, and hopefully with positive things to say. And Dr. Haddad, thank you so much for your time, and to all of your team for keeping us updated here today as well.
Thank you so much.
All right. Well, there's an interview that happened about an hour ago with Chief of Staff Dr. Haddad from Bluewater Health. And thank you to the doctor. And I want to say shout out to Christina for helping me set up that, and a few others. And let's just give the shout out to all the frontline people who are out there today. And thanks to all of you who are watching. I know there's lots of questions out there, and I'm sorry that we weren't able to pull that off live to get your questions answered. But as you see up on the screen there, you can visit bluewaterhealth.ca online. There's lots of information there. You can also call Lambton Public Health at 519-383-8331. And also Telehealth Ontario is also taking, they've actually installed, I think, an additional 300 lines to be taking all the calls that are happening. 1-866-797-00 And thanks to all of you for stopping by. Please take the time, if you found this valuable information, to click the share button and share it around. You just got it straight, as we say, from the horse's mouth, so we can ignore all the other stuff that's floating around and showing up in your inboxes. They are really on top of it, actually. Liz just pointed that out. Looks like they're really on top of it. And I feel very confident in the staff here at Bluewater Health. I know many of them as well. So they're, again, getting your facts from reliable sources, right? A lot of stuff floating around out there, conspiracy theories and all this stuff. And I'm not here to say who's right and who's wrong. I just know we just talked with someone, who's right there and is in charge of many, many things there. So thank you again to Dr. Haddad, Chief of Staff for Bluewater Health. Thank you again to all of you. And coming up tomorrow, I will have some more interviews. We'll be talking with Mayor Mike Bradley tomorrow. So keep an eye out for that at some point tomorrow as well. Also, just an extra plug tonight on the K106.3 Facebook page, and here on my Facebook page, it's Friday Night Music Fever, and we will be having some local musicians going live with us here tonight. So we hope you'll join us. That's at 8 o'clock Eastern tonight. Until next time, take care of each other. Stay safe and stay home.